Hello everyone. Today we are here to talk about a strategic plan that I have created for Brookdale Cornersburg. The strategic goal in this plan is to increase and maintain our census. In order to understand the culture of our organization, let's first talk about the company overall. Brookdale Senior Living is a national company that prides themselves on being the leader in senior care while still carrying out their mission, which is to enrich the lives of those we serve with compassion, respect, excellence, and integrity. Their vision states that Brookdale Senior Living will be the leading provider of wellness and healthcare solutions within the senior living industry. Brookdale is always striving to meet the customer's needs. This includes the residents and their families. They believe that the customer's needs are always evolving, and their goal is to keep up with the demands of the consumer. One of these goals is to allow for their residents to age in place without the need for a future move. While many assisted livings require a certain level of independence, Brookdale offers a comprehensive care model that provides care based on individual needs. An example of this would be allowing for the spouse of an Alzheimer's patient to live with their loved one, although they may not need care for themselves. Brookdale received the Best of the Best award in 2008. This award recognizes companies that are innovative and effective in providing senior living solutions. Part of this award includes the company's ability to retain and train quality employees. The company uses a different approach to interviewing candidates in which they look for those individuals who meet their culture and motivational fit. They also offer many benefits to their employees in order to retain them, including tuition assistance and health benefits. One program they have implemented is called their Good People program, in which they encourage their current employees to refer other potential employees and award them with a 10% pay for every hour that new employee works. At Brookdale, there are many levels of leadership, from executive, corporate, divisional, regional, and community. As previously stated, it is important that the company hires only the best candidates, and they use an intense interviewing process in order to find the right people at all levels. They also have many cornerstones, which are imperative to their cultural atmosphere, as well as guidelines for their followers. Take a moment and read the cornerstones that Brookdale has incorporated. So now that we have discussed the background and culture of Brookdale as a company, let's talk about our community here at Brookdale Cornersburg and some of the challenges we have faced towards increasing and maintaining census. I have completed a SWOT analysis to review our strengths, weaknesses, opportunities, and threats. In the SWOT analysis, I have found that our strengths include that Brookdale Cornersburg is able to meet the needs of multiple levels of care due to our pricing system for a la carte care charges. We are able to provide a continuum of care and do not make our residents leave when their care increases. We also allow for them to apply for Medicaid and remain in our community if their funds are depleted after 2 years. Our staff is very accommodating and friendly, which provides for a serene atmosphere within the community. Brookdale has 24-hour nursing available compared to the competition, who generally do not. It is not a requirement in the state of Ohio. We provide peace of mind with families that their loved one will remain in one community for the rest of their lives and will not be turned away later on. The competition has been known to not allow their residents to return if their care needs increase following a hospitalization. We are also able to provide staffing based on resident care needs versus census. All of our care needs are computed to allow for service alignment hours based on the needs of the residents. This allows for more care associates than the Ohio state standard of 1 aide to 15 residents. Competitors refer to us when their residents decline in function due to our ability to continue to care for them with high staffing ratios and less limitations of care provided. They are oftentimes not able to care for someone with oxygen or in a wheelchair. Now let's look at our weaknesses. We have a high cost model of care due to the individual charges incurred based on care needs. Our location is in an area that includes a population who many do not have the funds to meet the cost of care in most cases. Residents have been admitted and quickly discharged due to inappropriate behaviors not previously identified. For residents not requiring much care, it is cheaper for them to go to a competitor than to come to our community. Marketing strategies could be improved as there has been a high turnover in this department and marketing efforts have been lacking in the past year. There is also a rift with the management staff and communication. This needs improved in order to provide the best care to the residents without confusion. Activities is another area that needs to be improved upon. Oftentimes, the residents complain that they are bored and the activities are not always tailored to meet the needs of each individual. Our facility has a high population with Alzheimer's dementia along with several residents in wheelchairs. Some people are looking for assisted living early on and are turned off by our variety of residents. They see themselves as not ready for this level of care, despite the fact that we also have many residents who are still very independent. Competitors can offer them more people who they see most like themselves. Some opportunities that I see include that the elderly population is living longer and requiring more levels of care than in the past. They can receive care in an assisted living that once could only be provided in a nursing home. It is cheaper for them to receive this care in the assisted living versus a long-term care facility. Benefits are available to assist financially in order for this population to receive care in the assisted living. There is a great opportunity to market the area in order to find more residents who meet the criteria for our assisted living and the niche that we provide. By targeting key referral sources, census can be improved to maintain at full capacity. Increased opportunities exist for our activities program to further meet the needs of a diverse population. This could include increased outings and more individual activities to provide mental well-being for all residents. The threats I have found are many people are living at home longer and utilizing home health services rather than leaving their homes for assisted living care. Competitors are able to offer lower rates that people find appealing if their care needs are not such that they need a higher level. They are also able to offer a more elegant atmosphere to people who desire to be with only people like them. Those individuals are still able to ambulate and complete most of their activities of daily living on their own or with minimal assistance. Financial support comes from the residents in the community and what their needs are. Marketing is also given a budget based on the current census. This budget can decrease when census is low, which can make it a challenge to market effectively in order to increase census. Activities is also given a budget and oftentimes does not stay within that budget. They could improve on finding more creative ways to utilize the budget effectively to get the maximum benefit to the residents. The weaknesses identified have a great impact on increasing census and keeping the building full. If someone can go to a place that charges less and be with more people like them, they will. If they visit our community and activities are not happening as stated on the calendar, this makes our community look unorganized. Lack of communication amongst the management team also appears to potential residents and families as unorganized. Based on the SWOT analysis, I have identified 5 major goals that can be used in order to increase census and maintain it. The first one is that increasing the census by 5 residents in the next 2 months to maintain a census of 40 residents in-house with no more than 2 open apartments. Those eligible for bonus will be compensated quarterly based on maintaining the census. Marketing efforts will expand in order to reach out to the appropriate types of residents necessary to maintain this census. The sales and marketing manager will make contact with at least 1 competitor per week in order to analyze and market what opportunities we can provide that perhaps they cannot. Assessments will be more thorough in order to have admissions that will not require an immediate discharge due to inappropriate behaviors. The Health and Wellness Director will make every effort to obtain past medical history of behaviors and psychiatric disorders within 48 hours of notification of a potential admission and prior to agreeing to acceptance into the community. Communication will improve amongst the management team for all potential residents in order to make the transition into the community smoother for the individual and the family. The sales and marketing manager will be in control of communication and will facilitate communication of the needs of the potential resident within 24 hours of contact with the individual via email to all other managers. All other managers will continue this method of communication as new information is revealed. Activities will increase to meet the needs of each individual and will be maintained at a higher level of excellence. The activities calendar will be followed in a timely fashion 90% of the time, and residents will be notified by the activities director when an activity must be canceled. Outings will occur no less than one outing per week, and each resident will have the opportunity to attend at least one outing per month. Now that we have looked at what the goals are to increase census, we will need a thorough action plan in order to get started on achieving these goals. I have taken the time to provide you all with a strategic map. Please refer to this map as I guide you through our action plan. The strategic map began with the learning and growth perspective. In order to reach the goal of increasing revenue through census, it is important that various functions improve. The first way to increase revenue is through keeping the residents in the community satisfied with the care they are receiving from the direct care staff, including nurses and resident care associates. This can be accomplished through increased education to improve their ability through knowledge and confidence in the care they are providing. The best way to accomplish this would be through the use of management by objectives planning. This method incorporates the activities of setting goals, developing specific action plans, reviewing progress, and overall performance appraisals. An example would be to train the staff on fall prevention methods in an effort to minimize falls and keep the residents from sustaining an injury that would require hospitalization. The Health and Wellness Director would be responsible for providing the training and setting the goals. She also can use an analytical style of decision making through reviewing the data from monthly fall reports to identify if the methods of education are working. She would also use the classical model for decision making. This method is best when information is clear, conditions are certain, goals are known and agreed upon, criteria for evaluation of alternatives are known, and the decision maker can make logical decisions. In the example of falls, there is clear data available, the goal is to decrease falls, there are easy methods of evaluation, and the Health and Wellness Director can make decisions logically through analysis of the data. The second business function that is crucial to the success of increasing revenue through increased census would be the sales and marketing department. The sales manager is new in her role and is lacking in knowledge at times of all the services that can be provided. In order to increase her marketing efforts, the sales and marketing manager needs to understand her target audience and make the referral process as easy and smooth as possible for the referral source and the patient. She should be setting goals for a specific target number of admissions, how she is going to attain them, and if they are not being met, analyzing what else can be done to increase census. The final business function that can help improve revenue through increased census involves the activities provided within the community. There is a great opportunity for growth in this area as it is lacking significantly at this time. The activities director needs to focus on incorporating new and innovative activities that enhance the psychosocial needs of the elderly residents we serve. It has been noted that the same residents attend the activities while others never attend. The best method for improvement in this area would be to incorporate the management by means approach. This approach is more focused on the methods used to get results and not so much on the actual results themselves. These three entities of business all need to work together to provide an environment that sells. If the care being provided excels compared to the competition, the sales and marketing manager is able to confidently sell the services provided. If the activities director can engage more residents, the incidence of falls can decrease, thus causing less hospitalizations and loss of revenue. The managers of these departments will need to have ongoing meetings to discuss how they can each work together to meet the ultimate goal of increasing census. They also need to be aware of how their actions affect one another and set their goals collaboratively. Leadership strategies should include targeting customers. The main customers in the scenario include residents, families, the care staff, and the referral sources. There also needs to be a focus on the core competency of the organization that the sales manager can sell to make us stand out compared to other assisted livings in the area. If the managers can build the synergy between themselves, this will naturally improve the synergy of the company as a whole. Finally, there needs to be a valued service provided in order to maintain the satisfaction of all customers. Would anybody like to ask any questions at this time?